let's take a look back from the early days when you started looking at the factors that make African women, especially young African women, so vulnerable to HIV. There's an article in the Financial Times in which you said that young women's potential is ended before it begins. Can you just tell us about your work and how it led you to make this devastating conclusion?
Yeah. So that's a good place to start this journey that spans over 3 decades. So in 1988, I had the opportunity to study at Columbia University to do public health, which during apartheid South Africa was viewed as subversive, and we had no schools of public health. And I finished high school in 1976 during the time of the student uprising. My first degree was largely caught up in anti-activist protests, and a lot of the 80s, even as I continued to work as a medical biochemist, I was doing a parallel sort of life where I was working in communities that were very disadvantaged. And so in doing that, I got to understand better how apartheid policies was influencing and disadvantaging the majority of the population in South Africa on the basis of race. And so this opportunity to study public health actually brought together for me this passion I have for science and social justice. On returning to South Africa in 1989, I reflected on my year in the US, where we just recently discovered that HIV causes AIDS. There were many symposia, and just looking at the epidemic as it was unfolding in New York City, and then interacting with people from other parts of Africa, describing something similar unfolding there, the first question I started to ask myself on my return is, so why don't we know about HIV in Southern Africa, and particularly in South Africa and the province I live in KwaZulu-Natal? And I used the opportunity of an active malaria control program to undertake one of the first population-based studies. So my first question was, what is the magnitude of HIV in KwaZulu-Natal, the province I live in? And in doing that survey that included about 6,000 people, I found that HIV was rare. It was less than 1% in 1990. But what was striking when I did the age and sex disaggregated analysis, so first I did the sex disaggregated analysis, and I found that women had 4 times more infection. When I did the age and sex disaggregated analysis, I found that young women 15 to 19 had 6 times more infection compared to their male peers. And that when you move to the next age band, 20 to 24, you're seeing this increase to the point where about 12% of women at that stage were already infected with HIV. And then you see this 5 to 7 year difference in terms of when we start to see HIV in young men compared to the women. So immediately, when I saw this, the question as a nice inquiring scientist is why? And so I engaged in a whole lot of what we call socio-epidemiological studies amongst women in urban, rural, peri-urban populations, and also sex workers. And, at that stage, sex work was illegal. I worked with mothers of teenage kids because, of the restrictions, working directly with adolescents. But eventually I did get to schools and health facilities. And the thing that was coming through very strongly, because by then I'd done 2 other surveys within a 24-month period, and found this trend was continuing. And then I'm seeing this, here's the magnitude of the problem. So of course, I was seeing the rapidity of the spread of HIV, was seeing this consistent pattern of young women. And the 2019 UNAIDS Global State of the Pandemic data, or 2020 report based on the 2019 data, shows that 25% of the infections globally are in young women 15 to 24 years. So I didn't start off saying, I'm going to study young women. The data took me there. And then when I did confirmatory and repeat trials looking at temporal trends, there was consistency in that. And then I was hearing from the women themselves, whether they were mothers or in sex work or adolescents, that they understand their risk. But everything we had available depended on male cooperation. So if your partner, say you're 20 years old, your partner is 25 or 26 or 27, you likely would have had a child and dropped out of school. So you get caught up in endless and vicious cycles of poverty and dependency. So you need a man in your life, and a man for accommodation, a man just to survive. And now this man, you're trying to tell him he may have other partners, as we've learned. It's his behavior putting you at risk, not your behavior. So that's when the conversation with this diverse group of women I was interacting with started to shift to, well, can't you give us something to enable us to protect ourselves? So I just wanted to go back to your original question about so I hope this background helps you understand it. So what happens is when young women get infected with HIV, up to about 2005, it was inevitable death. So, many young women, before even reaching the age of 21, were dying from AIDS. They were dying from complications from pregnancies. It's children having children, and the complexities of that in terms of their health and also the health of their children. So what we're seeing is this intergenerational impacts, because we know when mothers die, the life course for the child is very different from if a mother finishes high school and then, has children. The cognitive ability has matured, what she decides and how she decides, and her life trajectory is so different. So what I was talking about that I had gleaned from the data and confirmed with the socio-epidemiological studies was that, in terms of development, we look at survival of infants. And so if infants die within the first year of life, and the larger the number, we say that's really, this country is doing very badly. And over the past 30 years or so, we've done a great job in terms of equal numbers of girl children and boy children surviving age 1, age 5, age 10. And then what we're seeing is as young girls enter this phase of secondary, as young boys do, secondary sexual development, we're seeing a divergence. And that divergence was being manifested, and the indicators for it was HIV and pregnancy and STIs to some extent. And that's what I was talking about in the financial, that for young women in many parts of Africa, their potential was being wiped away during this period, and all the gains we'd made while they were children, and now as they're entering adulthood, was being undermined, and that we needed to pay attention to this because 65% of the population in Africa is under the age of 35. That means our demographic dividend is the youth. And if half of that youth are being lost by age, before the age of 20, it's a cause of serious concern. So that's a little bit of a long story, but long answer to your short question.